This video is covering Chapter 7, the skeleton. This is going to be a little bit of a shorter chapter, so the goal for the lecture when covering the skeleton is not to be able to name and claim and identify all the parts of bones, but this is going to be a little bit more of an overview to the skeleton and some of the other pieces that are a little bit more functional besides just naming all the parts of the bone. So the focus for Chapter 7 in the skeleton is we're going to run through the major overarching bones and kind of where those are, and then some things on how it can go wrong and the homeostasis of maintaining the skeletal system. As we go, you'll notice that I have condensed all of the PowerPoints into this one video. So I've taken out a lot of the repetitive and we're really only going to focus. So this particular video is going to cover all of Chapter 7, but it's going to be more of an overview. Anything that's in this chapter related to the skeleton that is not covered in this video will not be on an exam. The nitty-gritties of the skeleton is more of a lab type exam, so that information will be covered there. So just starting with looking at the skeleton, where we're going to start is the two major divisions. So the skeletal system will consist of bones, cartilage, joints, and ligaments, essentially anything that is connected to or holding the bones in place. There are two major divisions to our skeletal system, and this is how the PowerPoints are broken down. You will have the axial, which is everything going to be on the midline of the body, and then you'll have the appendicular, and the appendicular will be anything that is attached to the midline or is going to be how it is attached. So axial is going to consist of anything on the midline, and appendicular is going to be attached or off the midline. So when we look at the actual skeleton, the axial skeleton is going to be covered first. So this is going to be part 1 with the axial skeleton. And the next slide shows the overall concept of what we're talking about. If we were to draw a plumb line right down the middle of this skeleton, anything that's on that midline, or in this case, it's going to be the green, will be the axial skeleton. So that is what we're covering in this part of part 1. So when we're looking at the axial skeleton, it's going to consist of the skull, the vertebral column, and the thoracic cage. So these three areas, we're going to do a high-level overview of the bones that make up these areas, where you can find them, and a little bit of high priority information. But these are the three areas that are going to be related to the axial skeleton. So we're going to have our skull right here, our vertebral column, which is going to be actually on the midline, and then our thoracic cage, so all the green. And this is just the view from the back. So starting with the skull, we're going to start at the top of the axial and then work our way down. So starting at the skull, it is actually going to be comprised of two sets of bones. You're going to have your cranium, which is number 1, and your facial bones, which is number 2. So you'll have your cranium and you'll have your facial bones. So you do need to know the bones that make up these areas. So with your cranium, it's going to be this section right here, so bones of the cranium, and then this side, and then when we get to the next section, when we're talking about the facial bones, we'll talk about some of these other pieces. So the bones of the cranium, when you're looking at these, all of these are going to be connected in our skull through something that is going to be called a suture. So a suture is how all of the bones in our skull are actually going to be connected. It gives them a saw-like perspective. So they kind of look like this, and they're connecting one bone to another bone, but these bones are sewed together like this. So what you actually see is going to be this suture. So if you zoom in right here, how we have this suture right here, that is what we're talking about. So all of the bones that are connected in your cranium are going to be connected by these sutures, or this saw-like appearance where they're put together. Okay, so within our cranium, there's a lot of cavities, Holes, for lecture, you do not need to be able to name or claim or look at all these. What you do need to focus on will be just the overarching bones that make up the cranium. So the cranium is made up of 8 cranial bones, and you do need to know all of these. So we're just going to kind of highlight them on this picture down here. You need to know the frontal bone, which is this yellow forehead section. You'll need to know where the parietal bone is, and these are going to be the sides of the head. The occipital bone is all the way in the back, so this is the back of the skull. That will be the occipital bone. The temporal bones are going to be right above your ears on either side. You're going to have a right or a left. Let's see if they're labeled. Not on that one. But here you go. Here's your temporal bone. So it's going to be right over your ear. And another bone you're going to have in your cranium is your sphenoid and your ethmoid bones. So your sphenoid and your ethmoid bones, these are going to be this guy's right here. Essentially, they are deep inside the skull. So if we were to look at this image right here of your actual brain, so this is or your skull, this is your skull, and you are slicing right at the ears all the way across and removing the top of your skull. So what you're looking at right here is this section that's highlighted pink. That would be your sphenoid bone. It's right behind and underneath kind of your nasal cavity. It makes up kind of that back part of your nose. And then your ethmoid bone is going to be right here. It kind of makes up directly the back side of your nasal cavity, but it's also deep inside the skull. So you don't need to know the parts of where all these bumps and grump and all these parts, but you do need to know when we're talking about this cranium, these are the 8 cranial bones of the cranium, and you do need to know just where those are. Anything that was not named, you do not need to know. So the next section is going to be the facial bones. And so when we're talking about the facial bones, this is going to be made up of 14 bones, 12 of which are paired. So essentially all of these are going to be times 2, which means there's a right or a left, except for your mandible and your vomer. So all will have a right part and a left part when we're looking at these facial bones. So the ones you need to know and where they're located are going to be the mandible. So we're going to, looking at this guy right here, we need to know the mandible is going to be this bottom part of your jaw. It's essentially the part that will hinge. You also need to know your maxillary and your zygomatic bones. So coming up here, you can look at your zygomatic bone, which is going to be this guy right here. There's your mandible. Your maxillary, this side you can only see the one. So zygomatic, maxillary, and nasal bone are all going to be times 2. So remember, when we're looking at that, that means there's a right and a left. So if we come up here and look at this guy, and we were to split a plumb line down the middle of him, like that, you would have a right side and a left side. So that means when we're looking at our maxilla, right here, there's a right and a left. Your mandible is just one piece all the way across. It doesn't have a right or a left. Your zygomatic bone or your cheekbones have a right and a left. And your nasal bone will have a right and a left. So the other sections we'll need to know from our facial bones, we covered those, is your lacrimal, which is going to be your tear ducts, kind of inside your eye, your palatine, which is going to be the top part of your mouth, vomer, and your inferior nasal conch. So we're looking for these 4 bones on our skull. Your lacrimal bone is right here. It's the inside of your eye socket. Then you're also going to have your, all those other ones are going to be up here. Your inferior nasal conch is going to make up some of the the septum in your nose. Your vomer is also going to be deep internal. Here's your lacrimal again to make up the inside of that eye socket. And your I think that was everything that we were going to cover. Your inferior nasal conch, we have already found. Okay, so those are the bones of the facial bones that you're going to need to know. The next part of your, on the midline, is going to be your hyoid. So your hyoid is not a bone of the skull. So this is actually a really cool bone because this is going to be the only bone in the entire body that does not connect to another bone. So when we say connect to another bone, what we mean is articulate. So whenever you see the connection of a bone to a bone, that means that is going to be an articulation. So when we do not have that articulation, it is going to be essentially a disarticulation or disarticulated bone. So your hyoid bone is a disarticulated bone, meaning it does not connect to any other bone, which is very, very cool. Ligaments keep it in place. And so it will be found right here in your neck. It's where your muscles for swallowing and speech, the backside of your tongue, will actually connect. So that's where your hyoid bone is. Okay, so that's covering the first part of the axial skeleton. Now moving on to the second part of the axial skeleton, we're going to do the vertebral column. So this was also on the midline, and the vertebral column will consist of a very organized set of bones. So this is going to cover from your skull all the way to your pelvis. It may also be called the spine or the spinal column. You'll hear that. And what it actually is really, really important is it will transmit weight for all of the upper part of the body to your lower limbs. It'll protect the spinal cord and it will provide an attachment. So when we're looking down here to your vertebral column, essentially this is our lovely little stick figure right here. Your vertebral column will be coming down your backbone right here all the way down. So this is your vertebral column, and it's very organized in a very specific way. So it is actually going to be made up of 26 bones, and these bones are going to be called vertebrae, and they are going to be organized in a couple different ways. So they're going to be organized mainly into regions. So the regions, these 28 bones are going to be broken up into 5 regions. So we will have the cervical, then you have the thoracic, then you will have the lumbar region, then you will have the sacrum, and then the last section you will have is the coccyx. So inside each of these sections, these 28 bones are going to be organized. So your cervical area of your spinal cord, your vertebral column will have 7 bones or 7 vertebrae, where your thoracic column will have 12 vertebrae. Your lumbar will have 5 vertebrae. Your sacrum is going to be 5 fused. So these are 5 individual vertebrae, but they are essentially now in one actual structure. They've been fused together. And this is going to be fused bones. There's usually about 3, but it will come together into one. So if you're trying to remember, cervical is 7, thoracic is 12, lumbar is 5. The way I learned this is breakfast, lunch, and dinner. You want breakfast at 7, you want lunch at 12, and you want dinner at 5. And that kind of is the order. So with these, the way they're organized is here's our vertebral column. If you look at it straight on, like our little person right here, and he's smiling, you cannot see the curve. So there's no actual curve to the vertebral column. However, if you were to turn our lovely little person on the side, he does not have this straight back. So it is not going to be a very, very straight linear perspective. It looks like it from the front, but it's not from the back. What you're actually going to see with our little dude is when we turn him on the side, is you will see this perspective where there are going to be something called natural curvatures to the spine. So these curvatures to the spine are going to be like this. And so you will have these curves that will go in order of these areas. So I just want you to notice real quick, I drew my curves in a different direction because this little guy right here with this curve, he is actually looking the other way. So I don't want you guys to get confused with why this is different than this from the curvature perspective. Our lovely little guys are facing a different way. So with these vertebral columns and these curvatures, what you're going to have is curvatures with a cervical and lumbar curvature and a thoracic and sacral curvature. So we will have our cervical curvature like this, and we will have our lumbar curvature, our cervical curvature like this, and our lumbar down here, our curvature will like this. So they're both going to concave posterior, which means if you're looking from the back, which is this view, so this is the posterior, they will concave, so they'll tuck in. Whereas you'll have your thoracic curvature, and that will be a convex, which goes the other way. And then you will have your sacral, which will convex this way as well. So when you put these together, and our lovely little guy is looking this direction, his backbone is going to be technically a curvature shape that looks like cervical going this way, thoracic this way, lumbar this way, sacral this way. So that is what you will actually see. Okay, so these vertebrae, these areas, we're not going to cover the ligaments. I meant to take these out so you guys can ignore all these. In between each one of these bones, all the way down the spinal cord, there are little sections of cartilage, and these are going to be called your intervertebral disc. So they are going to be cartilage that is going to be cushioned between each section. And they are going to allow for cushioning for all of the impact between the vertebrae to be shock absorbers. So that is what these are. We're not going to go into the specifics of each of these. I'm going to take these out. So how the curvatures can go wrong. With the abnormal spinal curvatures you can have, there are 3 types of abnormal spinal curvatures you can have. So here we go. Abnormal spinal curvatures. So you can curve a bunch of different ways. These are the 3 most common. If you have scoliosis, you are essentially having a lateral rotation of the spine. When you have a lateral rotation, that is side to side. So this is our plumb line straight down the body. You can see how this is not, it is curving this way. It should not curve side to side. You should, when you look straight on, have a flat curve or a flat straight line of vertebrae. But you don't with scoliosis. It's lateral, it's a side to side rotation. You can also have one that's called kyphosis. And this is the hunchback. So this is a dorsal curvature. It's an abnormal. It's accelerated. So this lovely, sweet little lady right here, if we were to draw a line right there, you'll notice that rather than doing the curve she's supposed to do with your dorsal, with having just a very slight curvature, in your cervical will go concave and then into your thoracic as convex. What you'll actually get with this one is you will have this dorsal curvature abnormally rotated out rather than your cervical concaved in. And then the next type of abnormal spinal curvature you can have is going to be lordosis. And this is also called swayback. So lordosis is going to be an accentuated lumbar curvature. So it's going to be further down. It's the same concept as dorsal, except rather than being higher up on the back, this is going to be a curvature lower down. So if we drew a plumb line right here, she should have a nice little curve to these sections, but she has this curve here, and then this is extreme right there. So that's an abnormal or excessive. Scoliosis is lateral, kyphosis is dorsal or hunchback, and lordosis is lumbar or swayback, maybe another term that you've seen. So those are some of the abnormal curvatures. This is a standard vertebrae. You don't need to know the parts, but you just need to be able to identify this type of bone. Okay, so looking at all of these vertebrae, we're going to start with our cervical first and do the general characteristics of your cervical vertebrae. So there are 7. So they are going to be named C1 to C7. So all the way down your backbone, it will be C1, C2, C3, C4, all the way until you get to C7. So at the top right here is the bottom of your skull, it's your head, and then right after this section, you will have your thoracic. So C1 to C7, these are the smallest and the lightest vertebrae. C3 through 7, all are the same structures. C1 and C2 are special. So C1 plus C2 are different than the rest of C3 through C7. C1 is going to be called the atlas, and C2 is going to be called the axis. And these structurally look different because at the top of this vertebrae, or this vertebral column, you're going to have your skull. And inside your skull is going to be your brain. Your head, as you know, can rotate in a lot of different directions. It can nod your head, you can shake your head, you can roll your head, you can move a lot of different things. Your vertebrae does not allow for a lot of flexibility, but this atlas and axis will essentially allow you to rotate your head because it becomes more of a pivot on a stick where you can rotate the head around this axis. So it's the specific structure of C1 and C2, atlas and axis, that will allow you to actually have rotation and movement of your skull. So that's really, really cool. The next, here's a little bit more information about the unique features for those. So the next section is our thoracic. This is going to be T1 to T12, and they are going to articulate or connect to your ribs. So we all have T1 all the way down till T12. These vertebrae are going to get slightly bigger as they go down. So that's this section right here, our thoracic, T1 to T12. So then the next one is going to be our lumbar. So it's L1 to L5, and this is going to be the area that will actually pick up the most stress because it has all of the upper limbs, core, torso being put together and impact being placed on these vertebrae. So this is the small of the back. These vertebrae are going to get larger as you go, but these are these 5 right here. Right below these vertebrae, you're going to have your sacrum. And at this section of your sacrum, you're going to have your sacrum, and at the very bottom of it, it's going to be your coccyx bone. So your sacrum is going to be 5 fused bones. So when I said 5 fused bones, it is S1 to S5, but these are all fused. So if you look at this, here is my S1, here is my S2, S3, S4, and S5, but you can see how they are fused here, 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 and here. So that's what's happening with our sacrum. This is where your hips will actually attach. And then at the bottom, you are going to have your coccyx. And this looks like a rattlesnake's tail, and it's going to be the bottom bone right there. Okay, so the last part of our axial skeleton is going to be our thoracic cage, or our sternum and our ribs. So this is the area that will be made up of your sternum anteriorly, and your ribs are going to be laterally. So the whole purpose of this is to protect your vital organ into your thoracic cavity. So it will really cover up your heart, your lungs, your top part of your digestive tract, your throat, your esophagus as it travels down into the torso. So it's really, really important for protection. It's also going to be where you connect your shoulders and your upper limbs, and where you connect muscles for all of these areas. So it's a really, really important one. So the first one we're going to start with is going to be the sternum. And the sternum is essentially what we call the breastbone. And it's made up of 3 fused bones. So these 3 fused bones will make up this one bone that we know as the sternum. They're going to be the manubrium, the body, and the xiphoid process. So when you're looking at this guy right here, which is our thoracic cage, here is your sternum. Your mandibrium is going to be this top part. It kind of looks like the top of a tie. Your body is going to be the actual tie itself. And then the xiphoid process, there's this tiny little tail that will come off. These are directly on the midline of the body, just like that. That will be the sternum. Its major priority is to protect the heart, because that really actually lies directly underneath it. And cool feature is this tiny little part at the bottom, the xiphoid process, isn't actually ossified until about age 40, which is just interesting to note. Okay, the next section is going to be your ribs. Within your ribs, there are going to be 12 pairs of ribs, and these are going to form the sides. So there will be 12 right and 12 left. Actually, let's do it this way. If this is the midline of my body, we'll have 12 on the right side and 12 on the left side, and they're all going to be paired together. There's 3 categories. You're going to have true ribs, false ribs, and floating ribs. So with our true ribs, these are the different types we have. Your true ribs will be made up of pairs 1 through 7. So these are going to attach to the sternum directly. So all of these bones, or these ribs, will connect directly to the sternum. So you'll notice here's a rib, he comes around, oh, he connects directly to the sternum. Directly to the sternum. That will be 1 through 7. And then you're going to have false ribs. And these are going to be pairs 8 through 10. And these do not connect directly to the sternum. They attach and connect indirectly to the sternum. So that means there's going to be cartilage that is connecting them, not the actual bone itself. So if we look down here, here's my bone. Oh, look, he actually connects to cartilage before he then attaches to the sternum. This guy right here is going to connect to cartilage and then attach. So these are your false ribs. And then you'll also have your floating ribs. And these are going to be pairs 11 and 10. Sorry, pairs 11 and 12. And there is no attachment to the sternum. So these are going to float. If you've ever heard the rumors of any kind of music artist or famous person who's had their ribs removed, essentially what they're usually talking about are these floating ribs right here. So it's going to be rib 11 and 12 at the very bottom. There is no attachment to the sternum. They are still protecting vital organs, but essentially they are only connected in the back. So these are the ones when people are talking about having ribs removed that they are talking about. Okay, The third part of this is going to be the axial, oh, sorry, not the axial skeleton, it's going to be the appendicular skeleton. So this is part 2. So the appendicular is everything that is attached to the midline of the body. So the appendages, upper and lower limbs, and how they attach. So it's going to fall into 2 categories. The pectoral girdle will be attaching the upper limbs to the body, and the pelvic girdle will attach the lower limbs to the body. So essentially you're going to have your shoulder and your hip. So looking at your pectoral girdle, this is your shoulder. It will be made up of your clavicle, and you will have 2, and your scapula, and you will have 2. So if you actually look at it from the side, here's going to be my lovely little gentleman, and he's looking this way. Here's his arms, here's his legs. When we're saying anterior and posterior right here, you are going to have your clavicles anterior, which means on this side right here, you will have your clavicle, your shoulder bone, whereas posterior, what we mean is this is where you'll find your shoulder blade. But it's going to be, both are going to be connecting at the pectoral girdle. So this will be your scapula, otherwise known as your shoulder blade. So these are going to attach both of the upper limbs to the axial skeleton and attach for muscles. So these are very, very important. So if you're looking at this, here is your clavicle on the front side, and then in the back behind the ribs, that is where you have your scapula. So your clavicle is also called your collarbone. You've got a piece that will connect to the midline of the body. That will be the sternum, sternal end. So here's my lovely little guy. This will connect to the midline. The acromion end will be far, far away, and that will connect to the shoulder. And then your scapula will be on the back side. It's also called your shoulder blade, and they are going to look like a triangle. So if I have my little person like this, and he's looking away, this will be the right side, and this will be looking left. It's not anatomical position anymore because he's looking forward. He's looking away. So this is going to be the back side of the head, so you can actually see the entirety of their hair. They're looking forward, which means they are not in anatomical position, which means right side matches your right side. So if we're looking at this, each of their scapula, they will have one on each side that will kind of have this shape. They are a little bit more triangular. And with these scapula that have this China triangle shape, they will all have borders and angles. So they will all have, let me decrease this down, 3 borders and 3 angles. So the borders are going to be 1, 2, 3. You don't need to know the name of them for this class. You just need to know that there's 3 borders. And then angles, you're going to have the same thing. You're going to have 1, 2, 3. So let me put these in a different color. And you're going to have, here's my angle 1, here's my angle 2, here's my angle 3. So you have 3 borders and 3 angles, and this is going to be for both your right and your left scapula. So those are really important. Again, you don't really need to know them, you just need to know that there are 3 places where they meet. So here's your lovely little triangle of a scapula right here. And here is a angle, angle, angle. And here is a border, border, border. So you can kind of see what's going on with those. And you have one on the right side and on the left side. Okay, so now attaching to the upper limb. How do we connect to our pectoral girdle? So there are going to be in our upper limb, we are talking about hands and arms. So you will have the arm, and the bone that is made up of in the arm is going to be your humerus. The bone that's going to make up your forearm is actually 2. You will have your radius and your ulna. And then the bones that make up your hand. And your hand is going to be made up of bones that make up your wrist, bones that make up your palm, and bones that make up your fingers. In your hand, you will have 8 bones that make up your wrist. These will be called your carpal bones. You will have 5 bones that make up your palm. These are called metacarpal. And you will have 14 bones that make up your fingers. These are called your phalanges. So these numbers and these names are the pieces you need to know for the upper limb. So the arm, the bone you need to know is the humerus. It's the main bone in the upper limb. It's the longest and largest in the upper limb. And when you're looking at this for your humerus, this is what we're looking at. So it's this bone right here, and this is where it connects to the body, and then this is where you will connect to the other bones. So you don't need to be able to identify the bone itself with all of the details, but you do need to know the humerus and where it is located. So the next section is going to be your forearm, and these are 2 parallel bones that make up the forearm. So with my lovely little skeleton dude, he's going to look straight ahead. Coming off of his pectoral girdle, he's going to have his humerus, which is this guy. I'm going to give him an H. And there are 2 parallel bones that make up the forearm. So you will have a bone that's here and a bone that is here on both sides because you have 2 forearms. These 2 parallel bones are going to be the radius and the ulna. So this is where it gets a little bit tricky when you're looking at this. You'll notice that this is my right side and this is the left side of my little gentleman. On the right side, you are going to have these bones where the lateral one, the most exterior, will be your radius. So the lateral bone is the radius, where your medial bone, closer to the midline, will actually be your ulna. It'll be the medial. You cannot say the bone on the right versus the bone on the left because coming on over to the left side of the body, the bone that is the most lateral is the radius. And the bone that is the most medial is the ulna. So it's not right or left over here because on this side of the body, on the right side of the body, your radius is on the right side. But on the left side of your body, your ulna is on the right side. So it's lateral and medial, not right or left. But that's the forearm. It is the medial bone in the body for the ulna. And the radius is the lateral bone. So that's really what you need to know and see how they line up in parallel. Looking at the bones of the hand, they do include carpals, metacarpals, and phalanges. So when we're looking at our bones of our hands, in your carpals, I said this was your wrist, there are 8 bones. So when you're looking at your wrist bone, there are, in this section, 8 individual bones that make up your wrist. These are your carpals. And then you're going to have the palm of your hand, which is your metacarpals, and there are 5 metacarpals. So you will have 1, 2, 3, 4, 5. And then you're going to have 14 phalanges, and these are going to be started numbering 1 to 5. Your thumb will be called your pollex. So that's going to be a different term. Your thumb is called the pollex. So when you're looking at these digits and with this thumb, the phalanges are going to have 14 bones. Each of your fingers is going to have 3 bones. So digits 2 through 5 will have 3 bones. So here's my digits 2 through 5. I will have 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Those together are going to be 12 bones. But I said there's 14 bones in your phalanges. Your thumb or your pollex will only have 2 bones that will make up your thumb. So if you look at your actual hand, you can see that if you were to bend your fingers, there's 3 specific segments on all of your fingers, but your thumb will only have 2 segments. So that's going to be your hands. These are going to be your phalanges. And I did miss labeling the palm, which is the metacarpals. So this is your wrist, your palm, and your fingers. So right here, this will be your wrist, this will be your palm, and then these will be your phalanges. So that's the order of carpal, metacarpal, and phalange. If you've ever heard of the term carpal tunnel syndrome, it's because the ligaments that are going through the wrist right here are getting impacted. They're either getting pinched, they're somehow getting irritated, or inflammation of these tendons. So carpal tunnel syndrome is going to be a disorder or inflammation of the around the bones of the wrist, which are called the carpal bones. So that's how that full circle fits together. Okay, the last section is going to be the pelvic girdle, how we attach our lower limbs to our skeleton. So this is going to sometimes be called the hip girdle, and it is made of 2 hip bones and only 2 bones. But what's interesting about these bones is that these bones are going to be made up of 3 bones. So your pelvic girdle will be made up of 2 coaxial bones. So you will have a right and a left coaxial bone, but each coaxial is made up of 3 fused bones. So on my right coaxial, I will have a bone that is my ilium, my ischium, and my pubis, because these are 3 fused bones that makes up my right coaxial, but then I'll also have an ilium, an ischium, and a pubis that makes up the left coaxial bone. So there are 3 bones for each one coaxial bone, the ilium, the ischium, and the pubis. So looking at this right here, if we were to split a plumb line, this is going to be 1 coaxial, and this is going to be 1 coaxial. So each of these coaxials is going to have a ilium, an ischium, and a pubis. So you can see your ilium, your ischium, and your pubis. So essentially your ilium is going to be the top part where you actually feel your hip bone. Your ischium is going to be the bottom back part, and the pubis is going to be the front part near your pubic region, and that will be on your right and your left side. So ilium, ischium, and pubis make up the coaxial. Here it is broken out if it's helpful to see it, but those are very, very confusing. I mean, we're not going to go into detail on naming the parts of the 3 coaxial bones, 3 parts of the coaxial bones. Okay, so what's one thing that's different in our pelvic structure is that there is a difference between male versus female pelvic girdle. And the reason we have a different structure for male versus female is because of childbearing. So because the pelvis is formed by the overall hip bones, the coaxials on the right and left, but it's also in the back formed by the sacrum and the coccyx. The female pelvis will tend to be wider, shallower, lighter, and rounder than a male's in order to produce and bear children. So what's going to happen with these is the female pelvis tends to be wider, shallower, lighter, and rounder. So we're looking at these female pelvises here. What we're talking about, this is the best one to look at, is you're looking at this actual circle inside, this space in the middle. In a female, it is wider, and in a male, it is narrower. So that's going to be the actual structure inside. You'll notice that these right here flare out. These will flare in. So this will be wide, and this will be narrow. And then you can also see right here the pelvic arch. This is going to be a wide pelvic arch, and this will be a narrow pelvic arch. So all of these allow for this because this is going to be the birth canal. So it needs to be a little bit wider. Okay, the last section is going to be the lower limb. So looking at your lower limb, it's going to be just like your arm, where it's going to be segmented into sections, your thigh, your leg, and your foot. So when we start at your thigh, with these areas, you're going to have one bone, and it's going to be the femur. At the bottom of your femur, it will connect to your patella, which is your kneecap. But your femur is going to be the largest and strongest bone in the body. So it is the Mac Daddy bone. The patella will be the bone that will actually connect and protect your knee. So when you're looking at this, here is going to be your femur with your patella. But then these will then connect to the bottom part of your leg, which is going to be made up of two parallel bones, the tibia and the fibula. So this is going to be very similar to the arms with the ulnus and the ulna and radius. So coming off my hips, I'm going to have my femur, which is going to be like this. We'll just make him a little shorter. And then what you're going to have is your two parallel bones. So you will have an outside and an inside, an outside and an inside. So these parallel bones are essentially going to be the exact same setup. So the one that's on the inside will be medial on both sides, and this will be your tibia. Your medial bone will be your tibia. And then what you'll have on the lateral on each side will be your fibula. So lateral, or the outside bone, will be the fibula. The inside bone will be the tibia. The fibula is actually not going to be weight bearing. It is so small. So when we're looking at this, here's the midline of the body with our tibia and fibula. This is where your femur and your patella will actually connect. Femur and your patella. There is going to be no connection to your fibula plus your femur. So your femur will rest on top of the tibia. It will actually not connect to the fibula. So that's very interesting. So then moving down to the last part of your foot, it's going to, the last part of your leg, it's going to be your foot. And your foot is going to be the same thing with, rather than carpals, it will be tarsals. And you will have tarsals, metatarsals, and phalanges. So if you're looking at your foot, the bones of your ankle, these will be your tarsals. And there are 7 tarsus is what you might also hear, but there are going to be 7 bones that make up your tarsals. These are essentially going to be your ankle. Coming off your ankle, you're going to have your metatarsals. And these are going to be 5. And this is essentially going to make up the ball or the actual bridge So looking at these metatarsals, these are actually going to be the part that makes up the arch of the foot, and there are going to be 5 metatarsals. So they're going to look like that. And then the next section you're going to have is going to be your phalanges. So these are going to follow the same setup as the phalanges in your hand. There are 14 of them, and your big toe will have 2 bones, whereas the rest of them will have 3 bones. So for this one, we said the pollex was your thumb. This one, the term hallux will mean your big toe. So within your phalanges, you will have your toe will have 2, but then all of the other toes will have 3. So this means your phalanges will have 14 bones because your big toe or your hallux will only have 2. So you can see how this works right here. So here are these are your bones of your ankle. Here are the bones that make up your arch of your foot. And then your phalanges, there's only going to be 1, 2, but the rest of them will have 3. Okay, so one of the things with this skeleton is going to be the developmental aspects. So the infant skull has more bones than the adult skull, and that's because a lot of the bones are going to be unfused in an infant and then will fuse in an adult. So throughout development, your bones will actually fuse during your lifetime. And so as they fuse, you will end up with the 206 bones that are present in an adult skeleton, but as an infant, you will have a whole lot more that will then end up fusing. So one way that we see this fusing the most is going to be in the skull. And so these skulls are going to be connected by things that are called fontanelles. So between your unfused bones, so in development, early childhood, when your bones have not fused together completely, you will have an area of space and membrane that are going to be called fontanelles. These are also called the soft spot on a baby's head. You may have heard of that, but they allow for the brain to grow. These fontanelles are going to be found in 4 places: on the front, on the back, near the jaw, and by the side. So these 4 fontanelles are going to be the space. Essentially, in an adult, when you have a bone connected to a bone, they're going to be connected completely in an adult. But in an infant or in a young, to be connected so easily. So it'll be, rather than in an adult where they are connected like this, they may be connected with space in between, and this will be a fontanelle. So you can see the space here between these bones. That's the fontanelle, the frontal or the anterior, because it's connecting the frontal bones. But you can also see how we've got the one right here, which is the sphenoid on the side. We've got this one, which is the temporal in the back, and then on the back of your skull, you'll have this one, which is your posterior fontanelle. So these are where the bones of the skull will actually connect. When they do actually fuse, these will form the sutures. The points between these connections will be embedded and be a part of the sutures. So when we're looking at this developmental, it's really, really cool to be able to have the ability for this skull to grow in relation and proportion to the brain itself growing. So with this, you'll notice that with our skull, there was a lot of right or left. So when we did our head and we split it down the middle, there was always going to be a right side or a left side because we are actually going to be bilateral organisms, and so we develop a midline. However, cleft palate is one of the most common conditions because it's no fusion of the right and the left at the midline. So that means as we are approaching and developing in, we are not necessarily meeting and doing the medial fusion. So there's no meeting at the midline. there's a space, there's an incorrect development. This is usually going to be seen in a cleft palate. So here is the midline. They have not developed these bones of the skull all the way in. We can fix it, we can treat it, but this is technically what's happening with a cleft palate. And then one of the last things with our developmental aspects of our skeleton, at birth, your cranium is incredibly large because the body is very small. But then as you grow the body, the cranium will actually get smaller until as an adult, the body is going to be larger than the cranium. So we will grow in a different proportion, not just the skull and the body growing at the same rate. The parts of the skeleton will grow at different rates. So that's the goal for chapter 7, the skeleton. I said the biggest takeaway is all of the additional pieces and the overarching bones and how many there are in each area, but not the details of naming and claiming all the individual parts, tuberosities, condyles, and bumps and holes inside all the bones. So that's the goal for chapter 7.